I'm here today in the jungles of South America trying to locate the reservoir of the vector-borne disease, yellow fever. Yellow fever is transmitted by a particular mosquito called Aedes aegypti. Let's see if I can get one to bite me. Look, there's one now! Well, if that mosquito did indeed carry yellow fever, the pathogen will now travel through my body, entering via the dermal tissue or blood vessels under my skin. It will attach to my leukocytes, platelets, and endothelium, dodging around corners from my immune system and destroying my leukocytes, causing immunosuppression. We'll have to wait and see, however, because symptoms will not arise for 3 to 6 days.
Several days later.
Okay, at this point, I've developed a fever, a headache, and a tad bit of nausea. This really could be anything, though, so we'll have to wait and see if my symptoms get worse.
3 days later.
Today, I actually feel quite better, so I've either entered the remission phase of this disease, or I never contracted it in the first place. Only time will tell.
24 hours later.
I'm not feeling so good today. Do I look okay? I think I need to go to the hospital. As you can see, Doc, I'm filming a TV show. I purposely got bit by a mosquito trying to contract yellow fever virus. And I think I have it.
Well, what kind of symptoms have you been experiencing?
Well, at first, I had a fever, a headache, nausea. Now, I've got the jaundice, and I'm bleeding from all kinds of orifices. You know all now.
Okay. I really think that you probably have contracted the yellow fever virus based on your symptoms. The symptoms of this virus pretty much come in 2 phases. There's an acute phase, which is probably what you start out with: fever, chills, severe back pains, headache, nausea, vomiting, and fatigue. Then you usually go through a brief remission period, which you also probably experienced, and then you get to the toxic phase, which usually includes bleeding from your orifices, black and bloody vomit, jaundice. And if your symptoms persist in later stages, you could experience lack of kidney function, hypotension, shock, metabolic acidosis, acute tubular necrosis, myocardial dysfunction, and cardiac arrhythmia. But let's take some blood samples and go to the lab and see if the antibodies are present.
It's okay, I'm a professional.
In the lab, the best way to confirm the infection is to take a blood serum sample from the supposed infected patient. From the sample, I will use several techniques to measure the antibody response. Serologic methods used in studying antibody response to yellow fever includes hemagglutination inhibition, complement fixation, enzyme-linked immunosorbent assay, and the indirect fluorescent antibody test, IFA. Neutralizing HI and IFA antibodies appear within a week of onset. CF antibodies appear later. We will run all these tests, but the only one that we will get the results of right away is the ELISA test. The others will take several days. And it looks like the results are in, and it does look like the patient is positive for yellow fever. The causative agent of yellow fever is a virus classified in genus Flavivirus, which is in the family Flaviviridae. The virus is small in size, only 35 to 45 nanometers, and contains a positive single-stranded RNA as genetic information, a polyhedral capsid, and a lipid envelope.
Alright, well, your blood test came back positive for yellow fever. And there is really no treatment for this disease, but we can offer you supportive care. We can give you fluids and electrolytes to balance dehydration and help with your fever. And we're obviously going to keep you here in the hospital. And that's really all we can do for you. You have a 50% chance of surviving.
I'm going to survive, Doc. The virus won't win.
I guess the virus won this time.
That was quite a tragedy. However, this could have been prevented by many ways. The main way was using the vaccine for the yellow fever. The most common vaccine is 17D, which provides immunity in 1 week to 10 days of administration, and it could last 10 to 30 years. Many other ways are there too. One of them is after receiving the vaccine, precautions should be still taken by using insect repellents, mosquitoes nets, and the mosquitoes repellent should contain DEET. Another way to prevent the disease is to control the mosquitoes population, which is done by public spray. That's it.